Well, last year, Jenna Hollett and her partner received heartbreaking news. Judah Morgan, the 4-year-old they fostered for 3.5 years, was killed by his parents just months after being returned to their care. Hollett held a vigil for Judah in October, and she's advocating for child welfare and system change at the statehouse. Benta Boutier reports.
You guys have a candle?
Gina Hollett organized the vigil in LaPorte, joined by family, fellow foster parents, and child advocates to remember Judah. She was a kinship placement for Judah, technically his second cousin.
Are you funny?
I held him just a couple minutes after he was born, and I knew I loved him then.
Kinship placement is a care method the Department of Child Services has been leaning toward in recent years because it keeps a child closer to family. Hollett went through foster care herself and didn't want her family to go through the same experience.
I wanted to help, and I didn't think that Judah, being a family member, should be out of the family. I thought that he would adjust better with family, and I knew that as a mom of 3 children that I could supply him with that love and with the affection that he would need.
Kinship caretakers like Hollett often aren't licensed foster parents. It means she had less control in Judah's case and didn't receive a stipend from the state when he was in her care. She took him often to the local park and misses having him with her. She wishes more weight had been given to their time together.
This is where he would play all the time. And then down by the river, we took him fishing there, and he liked looking at the little minnows and whatnot. Our last day with him, actually, we took him fishing and we brought him here.
One of the things she advocated for is called Judah's Law. Part of it passed last legislative session, allowing longtime caretakers to intervene in custody issues if they believe the child is in danger. Senator Mike Bohacek, who sponsored the bill, says the next part will give the law more teeth. It will help income-restricted kinship placements afford legal representation.
That part of the bill did not make it through because it was not a budget year. This year's a budget year, so we will be filing that part of the bill this year.
Hollett doesn't want to stop there. She and other advocates are gearing up for an important legislative session. She has a list of ideas, including ways the state could spend money they dedicated to vulnerable children and mothers during the special session this summer. Along with Senate Bill 1 that restricted abortion, Senate Bill 2 passed during the summer to dedicate $45 million to the Families First Fund, created to support pregnancy and families.
Senate Bill 2 should be more directed to support for foster and adoptive care, as well as services for the children. So I think a lot of that money needs to be allocated towards services, for the kids to not go through extra trauma that Indiana State is putting them through.
A lot of the money has already been allocated to things like supporting health of pregnant mothers and funding for safe haven baby boxes. Braylon Yerington also wants to see increased pay for DCS workers, which she hopes will improve oversight and prevent children from lingering in the system longer than necessary.
I, again, talked to a lot of employees of DCS and former employees of DCS, and the low pay is constantly brought up, and I do think it's contributing to turnover. And that would include attorneys for DCS and caseworkers, anyone really who works for DCS.
DCS had nearly 2,000 staff carrying caseloads of families and children in 2021, and 18,533 open cases by the end of the fiscal year. The DCS annual staffing report said it needed 92 more case managers to meet the agency's own guidelines. Only 9 out of the state's 19 regions met the staffing caseload standards. Yerington also wants easier access to mental health services. Advocates also want funding for legal representation for children in need of services. Bohacek says family situations are often complex and take time to work through. He says lawmakers are aware improvements to the system and more services are needed.
This is one of those things that you're going to have to keep working on this all the time because the problems change, in every family, and they become different every year.
For Hollett, losing Judah will be with her the rest of her life. She's created a Facebook group in his memory.
Changes aren't going to be made if I'm quiet. And I think that's why I've been loud, per se, because I know if I don't speak up and if my family just sits by and curls up in a ball and mourns, that nothing's going to change. And I don't want anybody else to go through what Judah went through. I don't want anybody else to go through what my family's going through.
For Indiana News Desk, I'm Ben Taboutier.
The Indiana General Assembly will reconvene in January for a budget session. Other areas of funding addressed in Senate Bill 2 include support for foster and adoptive care, increased access to child care, and programs to prevent children from entering the DCS system.